Where we live affects our physical and mental health. If we live in a place that is designed so it's easy to drive our cars, we're more likely to drive. If we live somewhere where we feel it's safe and convenient to walk or cycle, we're more likely to be active. So this affects how active we are, and the level of traffic will also affect the local air quality. Now this is important because these environmental factors will affect our risk of diseases, such as asthma, heart disease, diabetes, cancer, and it's also going to affect our mental health and well-being. We'd all like to live in healthy places, but new neighbourhoods are being built today which do not support people's health and well-being. They may be in the wrong place, without easy access to public transport or opportunities to walk or cycle. They may not have green spaces or trees nearby, which will affect people's mental well-being, as well as exacerbating increasing temperatures due to climate change. Poor design can reduce social cohesion in a neighbourhood. It can increase isolation and feelings of loneliness, and even feel unsafe for people to leave their homes. So the question is, how can we ensure that places are designed and built that enable healthier lifestyles? I'm working on a major research project called TRUDE. It stands for Tackling the Root Causes Upstream of Unhealthy Urban Development. And it seeks to understand decision-making for new urban development and in turn develop interventions that should enable healthier place-making decisions. As you may expect, it's a research project run by academics. But to ensure real-world value, we're not just collecting and analysing data from afar. We're seeking to really enable co-design. To do this, I'm seconded into Bristol City Council for half of my time. So, for 2.5 days a week, I work with the regeneration team to see in real time how decisions are being made that affect new urban development. We're doing semi-structured interviews, sure, but we're not only doing that. For half of my week, I'm working on live projects that will affect real people, conducting ethnographic observations and action research. I'm working with my council colleagues to support development of what's called a spatial framework to guide development in an area that's mostly currently industrial and warehouse buildings, but there are plans to change that to allow more homes to be built to tackle the housing crisis. I want to understand how communities can really be involved in shaping their local areas, particularly people from low-income neighbourhoods who have the most to gain from better environments. Better homes, employment opportunities, safer environments for children to grow up in, clean air to breathe. I'll spend the next few years within the local government regeneration team, supporting their objectives while also learning from them. This will support the wider TRUDE research project to make truly co-produced interventions that will hopefully enable healthier places to be built. With my City Council colleagues, I'll be developing an evaluation framework to monitor and report on the long-term success of the regeneration programme. It's an ideal opportunity to set up a longitudinal study to understand whether local people really will benefit from environmental change on their doorsteps. Bristol City Council conduct an annual quality of life survey, and I'd like to replicate some of these questions with people living close to the regeneration area to measure changes over time for these affected communities. But unfortunately, local government resources are pretty limited, so obtaining funding to measure a robust baseline before any planning permissions are granted or any construction starts is really important. Then, a few years down the line, I'd like to return and understand the true impact of change on the lives of local people in that area, and really develop the evidence base about how regeneration and environmental change impacts on people's health and well-being. Because of the timeframes involved, it's a hugely under-researched area. Natural experimental studies like this are few and far between, but crucial if we are to understand the impact on real people's lives. My embedded research role in Bristol City Council has helped me to identify this research opportunity, and I hope to obtain additional funding to measure the baseline and use it to improve our understanding of how to bring about the greatest health and wellbeing benefits to poorer communities through regeneration projects.